Welcome. What is Neti pot and nasal irrigation? Can it remove nasal virus? Nasal irrigation is a personal hygiene practice in which the nasal cavity is washed to flush out mucus and debris from the nose and sinuses. The practice is reported to be beneficial with only minor side effects. Nasal irrigation can also refer to the use of saline nasal spray or nebulizers to moisten the mucous membranes. When used and cleaned properly, neti pots are usually safe and effective. The first rule of safety is to only rinse with distilled, sterile or previously boiled water. Tap water isn't safe to use as a nasal rinse because it's not adequately filtered or treated and may contain low levels of organisms, such as bacteria and amoebas. These organisms may be harmless to swallow because stomach acid kills them, but they can stay alive in nasal passages and cause potentially serious infections. In rare cases, these infections can be fatal. Medical uses. Nasal irrigation can be an effective therapy to relieve symptoms of both chronic sinusitis as well as acute sinusitis caused by upper respiratory tract infections such as the common cold. The evidence for use in chronic sinusitis is weak. To prepare an isotonic saline solution for nasal rinsing, approximate 0.25 liter lukewarm drinking water and 2.5 milliliters of table salt is required. It can also be useful for the temporary relief of the symptoms associated with allergic rhinitis. Improper use of neti pots can be dangerous and lead to infections, including the deadly Naegleria fowleri, better known as the brain-eating amoeba. Adverse effects. Adverse effects include nasal irritation, nosebleeds, headache, and drainage after the irrigation is done. It is generally well tolerated. There is a risk of infection if the water is not sterile or the device is not cleaned after use. If the device is used improperly, this can be harmful. In fact, proper application suggests the use of boiled water or saline water. In 2018, a patient was reported to have contracted Balamuthia mandrillaris after using tap water during nasal irrigation. Rare cases of fatal naegleuriasis have occurred due to nasal insufflation of the amoeba Naegleria fowleri from untreated tap water. Mechanism of action. Flushing the nasal cavity can soothe inflamed tissue and remove irritants like allergens. It may help clear mucus. Typical use involves the pouring or pumping of saline water through one nostril and letting it drain from the other. The water should not be tap water, which may contain small amounts of bacteria that are safe to drink but may be dangerous in the nose. The water should be sterile or filtered for microorganisms. If tap water is used, it should be boiled and cooled. Saline solution is also sometimes used. A number of other compounds may be included in irrigation fluids such as the steroid budesonide in an effort to treat chronic rhinosinusitis. Devices. Neti pots are commonly used and rely on gravity and head position in order to rinse the outer sinus cavities. Typically they have a spout attached near the bottom, sometimes with a handle on the opposite side. Various squeeze bottles for nasal irrigation have also been used to apply the water. Bulb syringes are commonly used for infants and children. There are also irrigation machines available that utilize electric motor-driven pumps. History. The earliest record of nasal irrigation is found in the ancient Hindu practice of Indian Ayurveda, whose roots are traced to the Vedas. It was customary to perform Jalaneti daily, as part of Socha. Jalaneti, which means to cleanse the nose with water, is an old yogic technique from India. The container used to administer the saline is called a neti pot. This process removes mucus and dirt and clears the nose. A second neti technique, known as sutra neti, uses a piece of string instead of water. General guidelines for neti pots. Leaning over a sink, tilt your head sideways with your forehead and chin roughly level to avoid liquid flowing into your mouth. Breathing through your open mouth, insert the spout of the saline-filled container into your upper nostril so that the liquid drains through the lower nostril. Clear your nostrils. Then repeat the procedure, tilting your head sideways, on the other side. When done this way, sinus rinsing can remove dust, pollen, and other debris, as well as help to loosen thick mucus. It can also help relieve nasal symptoms of sinus infections, allergies, colds, and flu. Thank you for watching this video. Goodbye.